Welcome to Occupational Medicine Issue 65, Number 4. I'm Anil Adisesh, Assistant Editor, working at Dalhousie University and based in St. John, New Brunswick, Canada. We've become familiar with evidence-based guidance. However, putting guidance into practice isn't always straightforward. Chronic obstructive pulmonary disease is a condition predicted by the World Health Organization to become the third leading cause of death worldwide by 2030. 10 to 15% of COPD is attributable to work activity, so it's welcome that David Fishwick and colleagues present a standard for occupational chronic obstructive pulmonary disease on behalf of the COPD Standard Collaboration Group. Occupational health professionals are uniquely placed to influence workplace health and should consider how these standards might be implemented in their areas of responsibility. Work-related injury and illness reporting by physicians on a voluntary basis provides data for the Health and Occupation Research Network, THOR, which originated from schemes set up in 1989. More recently, general practitioners with training in occupational medicine have taken part in this occupational reporting. Occupational injury reports from occupational physicians and GPs are compared in a paper from Raymond Ager's team at the University of Manchester in the UK. Whilst differences in the anatomical location, type of injury and industrial sector largely reflect the coverage by occupational physicians, the higher rates reported for the agricultural, construction and manufacturing sectors by GPs indicates some lack of coverage by occupational physicians of these sectors. Also, the benefits of the UK change to the use of a fit note rather than a sick note are seen with 14% of workers who had a work-related injury being given advice about returning to work with restrictions following the fit note introduction. In the THOR study, occupational physicians were much more likely to report cases of post-traumatic stress disorder, PTSD, than GPs, which may be explained by the types of industry sectors they cover. A paper from the University of Milan by Ficera and colleagues examines the risk factors for PTSD following bank robbery. They report the results of a longitudinal cohort recruited from members of an employer-sponsored post-robbery support program established by a large Italian banking group. These victims completed the Impact of Event Scale questionnaire at 7 days and 2 months post-bank robbery. Occupational physicians in North America will be familiar with independent medical evaluations, IMEs, which are written for the benefit of the person or organization commissioning the report and are not typically sent to the patient. In the UK, guidance from the General Medical Council in 2009 required doctors to offer to show or give a copy of any report written about patients for employment or insurance purposes before the report is sent. This can and has led to the subject of the report withdrawing consent for the report's issue. Jacques Tamin argues that the requirement for this further consent is not compatible with English law, a topic which might well prompt some letters to the editor. Enjoy this issue.